Hi, everyone. My name is Caitlin Murphy, and I am a research consultant for the Policy Center for Maternal Mental Health. And I am also a research scientist with the Milken Institute School of Public Health at the George Washington University. I'm delighted today to walk you through in a bit more detail the 2024 Maternal Mental Health State Report Cards created by the Policy Center for Maternal Mental Health. For the next few minutes, I'll be answering three questions. First, what are the maternal mental health state report cards? Next, what changed in these report cards from 2023 to 2024? And last, what actions can policy stakeholders take to improve state grades? As many of us know, the scope of maternal mental health need in the US is massive. Maternal mental health disorders currently impact 1 in 5 mothers in the US, and maternal mental health conditions are the leading cause of maternal mortality in the US, with nearly a quarter of maternal deaths resulting from suicide or overdose. We also know that screening is not occurring at the rates it needs to, with over 50% of maternal mental health disorders going undiagnosed. Treatment is also not occurring at the rates it needs to, with only an estimated 15 to 25% of mothers who need treatment currently receiving it. Critically, we know that these gaps are even deeper for mothers of color due to deep systematic inequities and racism within our healthcare system. We know that filling these gaps is not only a matter of life and death, but absolutely foundational for children to thrive. Despite these massive gaps, before last year, states were not scored on their efforts to address maternal mental health. A scoring structure can provide credit to states for the hard work that they are doing in this area and point to areas where states can improve. Launched for the first time last year, the Maternal Mental Health State Report Cards use 18 key measures to provide a snapshot of state efforts to fill the gaps in maternal mental health services. These measures span 3 dimensions of maternal mental health. First, there are 7 measures of maternal mental health providers and programs. For example, do states have enough therapists and psychiatrists with specialties in maternal mental health? And do states have maternal mental health inpatient and outpatient programs? Next, there are 6 measures of maternal mental health screening. For example, do states track the rates of maternal mental health screening? And do states use screening as a performance measure among their health plans? Third, there are 5 measures of maternal mental health coverage and treatment. For example, do states cover maternal mental health services for those who need it most? And is treatment occurring at the rates it needs to? These 18 measures were chosen from an extensive review of all available state and county level data sets relevant to maternal mental health. Although we know that much more maternal mental health data is needed, especially through a breakdown by race and ethnicity and more. I'm going to take the next few minutes to briefly walk through the 2024 state grades and how these grades changed from 2023 to 2024. In the process of this walkthrough, hopefully it will also illustrate just how many approaches states can take to address maternal mental health. The 2024 state report card shows 18, across the 18 measures, a letter grade assigned to each state. The 2024 grades range from B+ to F, with the lighter color states with higher grades and the dark purple and gray being the lower grades. This year, we had 3 states with B grades: California, Washington, and Pennsylvania, 19 states with C grades, and 29 states with Ds and Fs. This brought our aggregate US grade to a D+. It's important to note that the state grades have been inching upwards since last year, pointing towards the attention that states have been turning towards maternal mental health. From 2023 to 2024, there are 3 important changes we're seeing. First, the US grade improved slightly from a D to a D+. Second, the state grades inched upwards, with 34 improved state grades. This year, we did see 3 states receiving Bs, as opposed to just 1 state receiving a B last year. And this year, we saw 5 states with Fs, as opposed to 15 states with Fs last year. And third, despite these improvements, it is so important to note that we still have a very long way to go. 29 states have still received Ds or failing grades as of 2024. This year, we're also excited to announce that we've been able to add 3 new measures to the report cards. States were given points if their perinatal quality collaborative, or PQCs, currently prioritizes maternal mental health. Also, for the first time this year, we had access to state-level maternal mental health screening rates during the prenatal and postpartum period. States were given points if they were considered a top performer on ensuring that maternal mental health screening is occurring during the prenatal and postpartum period. I'm now going to briefly walk through each measure, as well as how the states performed in 2024 as compared to 2023. Our first 2 measures look at states' maternal mental health provider-patient ratios. Since access to specialized care is one of the largest barriers to maternal mental health care, we consider these measures absolutely critical. With regards to the maternal mental health prescriber ratio, an example of prescribers are psychiatrists with maternal mental health training. We see that 29 states and DC meet the prescriber-patient ratio, as compared to just 11 states last year. And with regards to non-prescribers, such as therapists with maternal mental health training, we're seeing much fewer states meeting that ratio. So we see this as a really important, needed growth area for states. Next, we know that for some mothers, a weekly or biweekly meeting with a therapist or prescriber simply isn't enough, and more intensive treatment is needed via an inpatient or outpatient maternal mental health program. As such, the report cards give state points for inpatient and outpatient maternal mental health programs. We see that 3 states had inpatient programs in both 2023 and 2024. And we see a slight increase in outpatient programs in 2024. We see that both Ohio and Virginia added their first outpatient program, and Florida added 1 additional program. Next, we also wanted to understand if states have taken efforts to create a strategic plan to address maternal mental health, as well as provide community resources to address maternal mental health. In 2024, we see that a maternal mental health task force was added in New York, creating a total of 12 states and DC that have a task force or commission with a maternal mental health strategic plan. Next, we also see a slight increase in the number of states that have community-based organizations offering direct maternal mental health services. This is an increase from 24 states in DC to 29 states in DC in 2024. It's important to note that this measure is actually a ratio and captures if there is at least 1 community-based organization providing maternal mental health services in a state per 50,000 births. As mentioned earlier, we were able to include data this year regarding the perinatal quality collaboratives, or PQCs. We found that 13 states currently do prioritize maternal mental health in their statewide PQC work. Next, I'll be sharing a few measures regarding state progress towards maternal mental health screening, knowing that we're still a very long way from universal screening. We're excited this year to include 2 new maternal mental health screening measures pulled from the state-level HEDIS dataset available for the first time this year. State-level maternal mental health screening rates were found to be fairly low. Yet we wanted to give credit to states who are considered top performers and screen at least 10% of their mothers. We found that 7 states screen at least 10% of their prenatal patients for prenatal depression, and 8 states report screening at least 10% of their postpartum patients for postpartum depression. Knowing that insurers are an absolutely essential part of this conversation, our next two measures look at insurer requirements. First, we see that only 8 states currently require their Medicaid insurers to track maternal mental health screening as a performance measure. Second, we see that only 2 states require insurers to develop a quality improvement program for maternal mental health services. These measures are examples of measures where data stayed steady from 2023 to 2024 in areas where we hope to see state improvement. Our next few measures seek to understand how frequently providers are submitting claims to insurers for maternal mental health screening and treatment. So, is reimbursement happening for these services? For now, we only have access to private claims data, but our hope is to be able to include Medicaid claims data in the future as well. Perhaps unsurprisingly, private claims submitted for maternal mental health screening are very low. This is because maternal mental health screening is often bundled into what's called the global obstetric package. But states are starting to carve out maternal mental health screening reimbursement to incentivize and ensure that it is happening. We gave states points if their obstetric providers submitted screening claims even 1% of the time. In 2024, states where providers submitted prenatal maternal mental health screening claims among at least 1% of their mothers rose from 3 states to 8 states. And states where providers submitted postpartum maternal mental health screening claims among at least 1% of mothers rose from 15 states to 19 states. When we turn to maternal mental health treatment, we gave states points if providers submitted claims for maternal mental health treatment among at least 10% of mothers. Treatment was considered at a minimum counseling for maternal mental health disorders, as well as therapy and psychiatry claims. Considering that 20% of all mothers experience a mental health condition, we consider the 10% rate a minimum bar of treatment received. In 2024, we saw the frequency of claims for prenatal maternal mental health treatment improving in 10 states. And we saw the frequency of claims for postpartum treatment increase in 4 additional states. Our last 2 measures look at state efforts to make service coverage available to those who need it the most. In 2024, the number of states that had extended Medicaid increased to 42 states and DC. And 10 additional states extended Medicaid coverage to 1 year postpartum, an absolutely essential opportunity for mothers to maintain their health coverage during the postpartum period. Each of the 18 measures that I just walked through are available on the Policy Center's website in a state snapshot. These snapshots allow you to review which measures your state has received credit for and which measures haven't yet been met. We encourage you to go to the Policy Center's website and check out your state report card at policycentermmh.org/state-report-cards. As you might have noticed throughout this presentation, all of the measures were intentionally designed to be something that states can take action on. When we ask, what will help states increase their grades in 2025? There are several answers to that question. First, we currently see that states do not currently have enough therapists and psychiatrists in maternal mental health disorders, specializing in maternal mental health disorders. Second, we also see that states currently lack maternal mental health hospital treatment programs and community-based organizations that provide maternal mental health services. Next, we know that states currently report fairly low maternal mental health screening rates among both commercial insurance and Medicaid plans. And last, we know that states are not currently requiring their health plans to create quality improvement plans for maternal mental health. To support states in addressing each of these gaps, the Policy Center has created a maternal mental health policy roadmap. You might be aware of the National Maternal Mental Health Task Force recommendations, which the Policy Center coordinated with. You'll see several of those recommendations as well as others if you go to the Policy Center's Maternal Mental Health Roadmap at www.2020mom.org/2023 Maternal Mental Health Roadmap. There are several federal and state policy recommendations you can find in this roadmap, such as ensuring that HRSA prioritizes maternal mental health provider shortage areas, creating a national maternal mental health provider psychiatric consultancy program, and much more. Thank you again for walking through each one of the measures with me today. As you may have more questions about the state report cards and the policy center's work more generally, we encourage you to reach out and start a conversation. Thank you.